doctoral student in the clinical psychology program. I'm going to talk to you about my thesis evaluation and talking about safe sleep training. So I'm going to talk about specifically like infant mortality and safe sleep. Infant mortality is defined as the death of a baby before his or her first birthday. In the U.S., black babies die 2 times more than white babies, but in Kalamazoo, black babies are dying 4 times more than white babies. In Kalamazoo, preventable causes of death are one of the top causes of death in Kalamazoo, and again, in Kalamazoo specifically, 75% of sleep-related deaths are accounted for by black babies, which is really shocking and sad. There are a lot of barriers to engaging in safe sleep practices, and a lot of those have to do with cultural sensitivity and differences between home visitors and their clients. Also different health messaging between like health professionals, family values, different things like that. So my projects focus specifically on training home visitors on how to talk to their clients more effectively about safe sleep in a more culturally competent manner using motivational interviewing skills. So we had 2 major groups in this study. We focus on home visitors, we also focus on the clients. So for the home visitors, they attended a 2-day safe sleep training that focused on motivational interviewing, cultural competency, and the American Academy of Pediatrics Safe Sleep Guidelines. And then they went through mock safe sleep sessions where they used all of those skills at pre and post. Those were recorded and later coded. They were also assessed on knowledge, attitudes, and behavior. And then the clients, we had 2 groups. We had a treatment group and a control group. Both groups had pre, post, and follow-up measures. At pre-post or at pre and follow-up, they were assessed on knowledge, attitudes, and behaviors of safe sleep, and at post-test, they were assessed on knowledge and attitudes. During that time, between pre and post, they also had a safe sleep session with their home visitor. The difference between the 2 groups is the treatment group had home visitors who attended the training. So overall, our results show that home visitors did not have an increase in knowledge throughout pre and post. They already had really high scores. So they had increases in cultural competency, and their motivational interviewing skills increased tremendously also. They had 3 out of 11 skills increase, and then the home visiting clients, their knowledge increased from pre to follow-up, and their behavior changes also increased pre to follow-up. We also found a correlation between knowledge and behavior change. So our training overall increased home visitors' ability to help clients engage in safe sleep behaviors.